Some of you may be taking some of these medications. These medications are not solely for congestive heart failure. So some of these medications may be taken for just hypertension. And it doesn't mean you have CHF, okay? So these medications are key in managing heart disease. Have you heard about what we call the ACE inhibitors or vasodilators? No? So these are medications that reduce your blood pressure. It dilates the blood vessels, making them relax, and then the blood flow is easier. So instead of your blood vessel being like, tight, it relaxes the blood vessel so that blood is able to flow, okay? We also have digoxin. That's pretty familiar, right? Digoxin. So this one helps your heart pump stronger, okay? Because sometimes the weak pumping of the heart is what causes the decreased blood flow. Beta blockers, it slows your heart rate, okay? So I know some of you will ask me, well, if it slows down my heart rate, doesn't that lead to decreased blood because you have less heartbeats in a minute? Decreased blood will be pumped to the rest of my body. Not really, because what happens is it slows the heart rate enough so that it improves the pumping action. Your heart needs to slow down a little bit so that it will fill up with blood, that it can pump. So if your heart is going like this, is there enough time for the blood to go in the heart? It doesn't fill very well, right? It's not filling because it's going like this. So with the beta blocker, it slows down the heart rate. So there you go. Blood comes in, pumps out. Blood comes in, pumps out. So that's much better than this. There's hardly enough time for the blood to come in to be pumped out. Oh, the water pill is another medication for CHF. So that's not the only use of it, but it will rid your body of the excess water. Now, some of you who may be on diuretics may also be on potassium, and that's because usually diuretics will make you lose potassium when you pee too much. But there are some diuretics that you don't need potassium, okay? There's a few out there where you don't lose potassium. So it just depends on your doctor which one they'll give you. But if you're on a diuretic and your doctor does not give you potassium, so it can be that's the kind of diuretic that doesn't make you lose potassium, okay? But of course it doesn't hurt to ask, right? You can say, do I need potassium because you're making me pee? So that's always a good question to ask, and your doctor can say, no you don't because this is the one that doesn't make you lose potassium, okay?